Let's hop into Section 5C real quick. It's acute coronary syndrome in an adult. We already talked about the treatment priorities for this earlier on with just ACS patients, so your treatment priorities don't change. The only thing that may look different is in the 5 and 10 when it says nitro or fluids. It's talking about if the blood pressure is lower and if it's an inferior MI. So if the infarction's happening on the inferior part of the chest, then we'll try to avoid the nitro or possibly fluids, depending on what their blood pressure is. So the EMD part, it really doesn't change. They're going to do the same thing that we talked about earlier. Nothing changes as far as EMR, EMT. That all stays the same as what we talked about earlier. Same with the intermediate, advanced. That all stays the same. And really, for the most part, the paramedic part stays the same too. It has this chart here at the bottom that you can go by, and it starts with when you obtain and analyze a right-sided 12 lead. If it confirms an acute right ventricular infarct, what you would do. If it doesn't, what you would do. In simple terms, it's just like what we talked about. If their blood pressure is below 100 and they're having a inferior infarct, then we're going to withhold nitro. We're going to make sure we have a large bore IV in place. We'll give aspirin as long as it's not contraindicated. If it's not if it's not an acute right ventricular infarct, then maybe we do give nitro as long as we have that IV. And then if their blood pressure is, not hypotensive and they haven't taken the Levitra Viagra or Cialis. The big thing to notice over here, we've kind of talked about it a little bit. If you can't get their blood pressure up or they have signs of pulmonary edema, it talks about norepinephrine again. And we're just going to titrate that to get their blood pressure to 100. We're not trying to get it above 100. We're just trying to get it to 100, and then we'll titrate to effect. And then if we don't have norepi for whatever reason, we can use dopamine. Same thing applies there. The little box at the bottom, it just says if the patient is still having ACS symptoms after 3 nitroglycerin administrations with persistent chest pain and a systolic blood pressure was above 100, additional nitro per protocol 16HH. So if you remember when you took your national registry or studying for that, it talked about your maximum dose of nitro is 3. Well, in our protocols, we can give more than that as long as their blood pressure is above 100 and they still have that persistent chest pain. With that being said, we will also start giving fentanyl as well. And I won't hit fentanyl too hard because I talked about that quite a bit earlier. But pretty simple here. Well, if you look at the very bottom there's your erectile dysfunctional medications. I would definitely know the order and the hours for that. It says do not give nitroglycerin to patients taking Viagra or Levitra within 24 hours or Cialis within 48 hours without online medical control consult. So Viagra, Levitra, 24 hours, and then Cialis is 48 hours. So definitely know that. Hint, hint. And that is it for Section 5C.